The growth has been pretty significant, and especially, I would say, in the last 10 years or so. And so what's happened is originally Lyme disease was the main focus, and still is, because there are about 400,000 cases annually in the United States alone. But now what's happened is a lot of other diseases are beginning to rear their heads, if you will, and we're up to about 20 diseases in this country. And some of the diseases are carried by the same black-legged tick that transmit Lyme disease, and that's problematic because if you get bitten by that tick, you can get more than one disease. So now we're seeing anaplasmosis or lichiosis, Bartonellosis, Powassan virus, and many other diseases. And from one tick bite, you can get more than one disease. So the increase in Lyme and the associated diseases is just unbelievable. Doctors are seeing an increase in co-infections with other tick-borne diseases, not as much with the viral diseases, though it does happen, like with Powassan, but Powassan case numbers are still relatively low, but it's serious because it has a 10 to 15% fatality rate. But they are seeing co-infections, for example, with babesiosis, with Bartonellosis, and anaplasmosis. Those, I believe, are some of the ones that they see most frequently. Definitely having co-infections makes diagnosis and treatment a lot more difficult because oftentimes, first of all, there are tests for some of them and maybe not for others. The tests are not that awful reliable, especially for Lyme. And so that really clouds the diagnostic picture for the clinician who's already struggling to understand all of these diseases and understand the limitations of the testing. And so to make a clinical diagnosis is very hard, and they often have to do that for Lyme. And they may be able to get positive test results for Lyme or the other tick-borne diseases. But again, it makes it extremely difficult for physicians, yes.